Those of you who have seen Michael Moore's great movie SICKO know who Donna Smith is. It's an awesome movie, and there's no way to watch Donna in that movie not be touched, not be moved by the situation. And then later you meet her and you find out that she's even better in person. She's a really wonderful person, but what you may not know about her besides her acting career is that she's a former journalist. She's an organizer, has been an organizer with the National Nurses United. She served for years as our co-chair of PDA's Healthcare Not Warfare Project. She's fought for a long time for single-payer healthcare for everybody, and she continues to do that. Ladies and gentlemen, Donna Smith.
Thank you, everybody. Good morning. It's kind of a historic morning for me. It's my first presentation with PDA that I don't work for National Nurses United in almost 5 years, so it's kind of an interesting transition for me. It's a happy transition, but it is a big transition of my life. Fitting that a little over 5 years ago, almost 6 years ago, Tim Carpenter and I met on the steps of the Rayburn House Office building after I had testified to Congress. I'm still the only insured American who's testified to our Congress about going broke while you have health insurance. And Tim introduced me to PDA at that time, and I expect I will continue my role with PDA in the future as the co-chair of the Healthcare Not Warfare campaign, and I'm thrilled about that. My husband and I have decided to move home to Colorado. We have been living in near Washington, D.C. for a time, and it's time to go home. It's time to be closer to the kids and the grandkids, and to help push Colorado's single-payer movement forward. I'll be acting as the executive director of the Healthcare for All Colorado Foundation when I get back to Colorado. So it'll be exciting and different, but it's been such a blessing. I often tell people it took a lot of healing to get through what this healthcare system did to my husband and I. It took 185,000 nurses loving us up for 5 years to help lift us to the point where we were ready to be a little bit more proactive and autonomous, and I can never be grateful enough for that. So those of you who are here from National Nurses United, Michael Lady, Karen Higgins, and Ken Zinn, thank you very much. I was really interested to listen to Medea and to Phyllis talk about the various points related to warfare. And as I've listened to the nurses do so effectively over the last 5 years, I want to pull this down and get us back to healthcare in a more human, individual terms of what's happening to people out there. Phyllis mentioned that it costs $1 million for one soldier to be in Afghanistan. That's in Afghanistan. There are other costs of that soldier being in Afghanistan that are happening right here at home in the United States. I'll tell you a couple of stories about a couple of soldiers that I know, so that we can start to own this more in a more human way, if that's possible. Just going to need more neighbors, friends, children in our lives. About a year ago, a friend of mine in the single-payer movement came to me, and somebody in PA came to me and wanted us to embark on a project of writing stories about veterans and how those veterans returning from Afghanistan and Iraq and around the world might be helped by Obamacare. So as I have done in the past, I often am the one who interviews those soldiers or those people related to healthcare horror stories and tries to come up with some narrative that we can use to illustrate a point. I told the folks before we started on this project, this potential project, that Obamacare would not do an awful lot of helping of the veterans, so it was kind of a fruitless project to embark on, but I would humor them and talk to a couple of the veterans. I was connected with an organization, Archie's Farms in Los Angeles. It's a place where veterans returning who are suffering from severe emotional distress and PTSD and having great trouble assimilating economically back into their communities can go and be taught about organic farming and some of the things that help them have some skills to build businesses, entrepreneurial skills, and so forth. So at Archie's Farms, they gave me the name of 3 or 4 soldiers I could interview and talk to them about their situations, their family situations, and how things were going for them since they got back. The first young man I met is now known as Forager Mike. Forager Mike, he got that name because he became homeless after he came home from Iraq. He couldn't support himself. He was suffering with not only physical but mental issues related to his work in the Army. He had a horrible back, couldn't sustain any real physical work whatsoever. The emotional strain broke his family apart. He was divorced within a very short amount of time after coming home from Iraq. And he admitted to me that he had been very, very rough on his wife and his 9-year-old child. So he was very interested to talk to me to find out what would Obamacare do for him. And sadly, as I looked at his situation, and I wanted to be upfront and honest with him, that I didn't see an awful lot it would do for him. So we started to talk a little bit about single payer and about what I believe. And he knew a lot about single payer and very much wanted single payer to be the law of the land. But this is a young man who has a 9-year-old daughter. Now he's a single dad. He's trying to co-parent this 9-year-old daughter. He's no longer homeless. He has a small apartment now. But basically, there's no help for him in terms of he's going to try and get insurance through an exchange when California's exchange is up and running. He'll try and get insurance through that exchange for his daughter, but the costs are going to be very high. As many of you may have watched, some of the costs for health insurance are going to go up a lot under Obamacare. They're not going to be better. And some people have the misconception, and many of our veterans are among those people, that the fact that we've passed health reform in this country means that they will be able to access health care. Many still don't understand what they're going to be is mandated to buy health insurance, a defective product. Many of you have heard me say in the past, it's a defective product sold to us to protect health and wealth, which might make you neither thing. It is not health care. Insurance is not health care. It's a financial product, and it's a flawed one. So Mike and I talked a little bit about that, and he's a little scared. Doesn't know exactly what he's going to do to provide health care for his daughter, his 9-year-old daughter. He's legally required to do so, and he doesn't know how he's going to be able to afford that. Right now, while his wife is working so few hours, his ex-wife, they qualify under Medicaid and Medi-Cal to get help. But it's a very frightening situation. That's Forager. I tell you Forager Mike's name is, you might imagine he picked it up because he was foraging for his own food in Los Angeles. In a park in Los Angeles is where he foraged for food after being decorated in Iraq for his war service. And he now makes hot sauce. So if you're interested in learning more about Forager Mike, go online and look up his hot sauce. It's pretty good. I couldn't help but buy hot sauce from Forager Mike. The other situation hits a little bit closer to home for me. My son Bradley, father of 2, one just born December 20th, went to serve in Afghanistan about 2.5 years ago. I was really worried at that point. He's been a little bit estranged from us because of his feelings about Mom being so outspoken in the peace arena. And I wasn't as worried. I was obviously very worried about him being killed there, of course, or injured. But I was also very worried about what might happen to him mentally and emotionally. What if he killed? What if he did kill? And unfortunately, Bradley returned from Afghanistan a very different man than he went. He did indeed. He was sent there on air reconnaissance to try and do security for the Army. That's not what Bradley did. Bradley did security, and he did lots of killing. And Bradley's not the same. We're not sure if Bradley's marriage will survive at this point. He's getting treatment. He is not working full-time either because he has a very difficult time holding down work. This is a 37-year-old man now who has worked hard all of his life, was approaching his 20 years of service in the military, having a very difficult time getting care, mental health care, through our system. So lest we think that the issues of war and health are not connected even for our veterans and what's happening for those people, as a mother, of course, I'm devastated that this wonderful jazz musician who loved the arts and loved so much that was about gentility and decency and humanity was turned into a killer in this military environment and now can't get the help he needs to heal. This is another reason his dad and I are going home to Colorado. What are those costs, folks, in our society? What are those things costing us? Not just in money, not just in cash. We're bringing an awful lot of these young veterans home without access to health care that they need desperately, the care that they need. And I want to close out just by connecting a little bit on the, because we know we need single payer, and I'll offer you a quick opinion on what I think we need to do. But also, how can you not connect what we're teaching our young people with gun violence in this country? And Medea, thank you for standing up in Congress and holding the banner up to the issue of gun violence. How can we stop, you know, how can we teach them not to shoot guns if we're teaching them to drop bombs? How can we do that? That's so inconsistent. Our kids, you know, how often did we hear when we were kids, you know, oh, do what I say, not what I do. That's not how our kids learn. We know that. They learn what we value as a society. And what we value right now is not health care, is it? What we value with our money is war. What we value is being vicious to one another and learning to kill. It's not learning to heal. And we have to learn to heal one another. So what will happen with single payer, I don't believe, this is my personal opinion, I don't think we're going to move single payer on a national level for a while. Do you? No. I don't. I don't think that's going to happen. I think there are states where we're moving forward very dramatically. PDA was a part of forming a group called One Payer States about 3 years ago in Wayne, Pennsylvania. That's a coalition of groups that are working on state single payer all over the country. There's now 26 of the states that are represented. We do calls every month and talk about what we're working on in our individual states. California, you often hear a lot about Vermont because they advanced the bill Green Mountain Care in Vermont, but you also need to know that California, Colorado, Illinois, there's just New Mexico, Oregon, there's a number, Maryland, lots of states are working on, you often don't hear that in the media, do you? There are a lot of states that are pushing towards getting to a single payer platform. It's going to take a while though. It's not going to be easy to get this done in any of the states, even Vermont that's passed the law. It's going to take a lot of work, but I would urge you, whatever state you're from, find out if your state, or you can also email me, and I'll be happy to connect you with people in your state who may be working on single payer. We have to get to the position where we provide a single standard of high quality care for everyone without financial barrier. Thank you very much.